Welcome, nurses! Let's review some more. NCLEX RN flashcards. Here we go. A29. Monitor the patient's blood glucose levels. Q30. A nurse is caring for a patient with a history of stroke. What should the nurse assess for during the recovery phase? A30. Changes in cognitive function and motor skills. Q31. What should the nurse do if a patient develops signs of an allergic reaction to a medication? A31. Discontinue the medication and notify the healthcare provider. Q32. A nurse is caring for a patient with a nasogastric tube. What is the priority nursing action? A32. Ensure the tube is properly positioned and secure. Q33. A nurse is caring for a patient with an infected wound. What is the priority action? A33. Administer the prescribed antibiotics. Q34. A nurse is teaching a patient with asthma about inhaler use. What should the patient be instructed to do before using the inhaler? A34. Shake the inhaler well before use. Q35. A patient has been prescribed warfarin. What should the nurse monitor regularly? A35. International Normalized Ratio, INR levels. Q36. What is the first action a nurse should take if a patient is in respiratory distress? A36. Administer oxygen. Q37. A nurse is caring for a patient with a pressure ulcer. What is the most important nursing intervention? A37. Reposition the patient every 2 hours. Q38. A nurse is caring for a patient who has just had a hip replacement. What should the nurse teach the patient to prevent dislocation of the hip? A38. Avoid bending the hip past 90 degrees. Q39. A nurse is caring for a patient who is at risk for aspiration. What is the priority nursing intervention? A39. Ensure the patient is sitting upright during meals. How much did you learn? Let me know in the comments. Like and subscribe to our channel for more nursing review videos.